comes to laryngeal cancer, there are varieties of strategy for treatment, but the overriding goal is to preserve the larynx or the voice box whenever possible, to preserve optimal speech and swallowing for the patient. This entails a variety of strategies. Sometimes those strategies are surgical, and sometimes they involve treatments such as radiation or chemotherapy. When possible, with a small tumor, we'll often approach this with a technique called transoral laser surgery. Using a laser to resect a small portion of the larynx and obtain negative margins, we can sometimes avoid the need for additional therapies and the side effects that go along with them. We can avoid at times the need for radiation therapy and the dry mouth and other associated symptoms that patients will often have. Among the other diseases we treat, this also includes salivary gland lesions. The salivary glands include the parotid glands, which are two glands located in front of the ears on the cheek. The other glands are the submandibular glands located under the chin, and the sublingual glands located under the tongue. Occasionally, we'll see tumors which grow in these glands. Most commonly, we see benign tumors which grow in the parotid gland. Oftentimes, we can approach these with a minimal access approach, using an incision quite different from the traditional incision. Traditionally, an incision was made in front of the ear, which came down onto the neck. We'll often employ a facelift type incision, the same incision that's used for a cosmetic facelift, to access the tumor and remove it in its entirety. This offers you both diagnosis and treatment with a minimally invasive or minimal access approach. The benefit of this is to not only hide the scar, but we work in conjunction with our facial plastic surgeons to provide optimal reconstruction. At times, when the tumor is resected, we need to remove a portion of the normal gland, which can create a divot in the area on the cheek. When we do this, when we do the facelift approach, we'll often use a fat graft or other tissue to reconstruct this area to create a smooth and symmetric contour to the face, providing optimal outcome for the patient.